I'm here today with Andrew McGuire, the Executive Director of California OneCare. Thank you very much for talking with us today.
My pleasure.
Tell us a little bit, why did you come to Netroots Nation?
Well, I have a very dear friend and board member who's a blogger on Daily Ecos, Shockwave. And he's, I think, not only incredibly committed to single payer, but he's very committed to making me come into the 21st century. And this is the year that I reach Medicare age. And so, I was 40-some years old before the web was even around, so for us. So I came here to primarily learn about who the people are that are committed and interested in single-payer health insurance, and to connect with them and to see how we can work together.
Okay, and tell us a little bit about the panel you sat
on. The panel that was the first day, the first hour, featured a woman from Healthcare for America Now, a gentleman from the California Nurses Association, and myself. Moderator was from Vermont, which is one of the states that's moving on single payer. And there was a little bit of a different point of view between Healthcare for America Now and myself. I think that the federal healthcare reform, which was a topic of discussion, is nonsense. And I think that if you're going to build a house, you don't use sand. And what we have with federal reform is we're building our healthcare reform on top of a mess, a complex, inefficient, costly, for-profit mess. And so my view is until we eliminate the for-profit private insurance industry, we're not going to have healthcare reform.
Okay. And now, one thing we did right after the healthcare bill was passed is we talked to a lot of folks to get their sense of what lessons the progressive movement can take away from that fight. And I'd be really interested in what lessons you think we should be taking away.
Well, the first lesson we should acknowledge right up front is that there was no mature grassroots movement in place to support single payer. Progressives have talked about it. There's been a lot of wonkish information about it, but no mature movement. A movement that to do this is going to be similar to the civil rights movement or the suffrage movement and so on. So the first lesson is you can't get what you want unless you have a grassroots movement. The second lesson was you can't depend on inside the Beltway politicians from Obama on down to do the right thing without a movement behind it. And so what we had is we had instantly single payer taken off the table. And if you're going to organize and try to get what you want and negotiate, you always start with what you really want rather than giving it away immediately. And I think that what we can learn from that is that you can't trust that bubble, that inside the Beltway bubble of wonks and politicians and mainstream media to ever do the right thing.
Right. And a number of people have expressed that same opinion. In fact, people were expressing that last summer,
right,
early on, saying that single payer should not have been taken off the table. And clearly you think that was a mistake to do so. I imagine there were people, especially in the administration, who say, well, you can say that, but we got a bill passed, and you can't say that we would have gotten a bill passed had we left it on the table. What would be your response to that?
Okay, we have a bill that's passed. It primarily takes effect in about 4 years. A little piece of it takes effect sooner. After it takes effect, we're still going to have over 20 million people uninsured. Now, if that's acceptable and is viewed as healthcare reform, then I have no idea what bad reform would be. And number two, there is no way that this legislation controls the cost of the private insurance industry. So we're going to be forcing people to buy private health insurance. When they buy it, it's going to get more and more expensive each year, and it'll get more expensive faster than inflation. So those 2 points I want to emphasize. When we have 20-some million uninsured and no cost control, that to me is not reform. And so I don't look at it. I look at it as a piecemeal effort that left in place the problem.
Now, would you agree with some of the folks who say that it was sort of a step in the door? I think Congresswoman Donna Edwards told us earlier that, she's still pushing for a public option, and she said that getting this bill passed was the first step to getting a public option. Would you agree with that? Do you think it is a step in the right direction?
I think the federal bill will never lead to a federal public option. I think that the only way we get to good reform and the reform that eliminates the role of the private insurers is at the state level. So if various people have said that this reform is going to lead to the public option at the federal level, I think they're mistaken. I don't think anything can happen at the federal level that the insurance industry doesn't want to happen.
Okay. One other question I always want to ask people, because a large base of our viewers are grassroots activists. So what can they do watching home to get involved on this issue? Right.
Well, in California and 13 other states, and there's a few others joining, there's efforts to get single payer state law. The method that Canada came to single payer. Saskatchewan did it first, and then the other provinces followed. I think, in a sense, we're furthest ahead, and people may argue with this, but we're furthest ahead in California. We've already had a policy bill for single payer pass both houses and get to the governor. Schwarzenegger vetoed it twice. We're going to get it to his desk again. Now, what can grassroots people do in California or other states? In California, you go to CaliforniaOneCare.org, or you go to the California Nurses Association websites, and there are ways to quickly get involved. There's all of that is laid out, and it's been in the works for a number of years now. The same is true in Pennsylvania or Ohio or Vermont or Maine or other states, is you can quickly Google and find the groups that are starting to work. In California, I think we've got about a 20-year history of getting people organized at the grassroots level. We did an initiative that failed almost 20 years ago, and that led to a lot of activists, first of all, having a wake-up call, showing that the insurance industry will spend whatever gobs of money it takes to kill an initiative. But it also made them realize that they weren't ready to really take on the insurance industry in California. We are literally constructing daily the grassroots movement, and we have many ways people can get involved in California.
Okay, great. And I guess my last question would be, if there's one message you want people to take away from this over a year-long battle to try to reform healthcare, what would that be?
Well, the first comment I would make about the federal effort for healthcare reform is that you got to see up close and personal what money can buy. And so you have the insurance industry buying reform that gives them over 30 million more customers, helped and underwritten by the federal government, by our taxes. And you got the pharmaceutical industry striking a deal for 12 years where you can't negotiate with them. So you saw the power of the lobby inside the Beltway. We're not going to get single payer by doing it in Washington, D.C. We have to go to the state level.
Okay, well, thank you so much for taking the time to talk to us today.
Oh, my pleasure. Thanks a lot.